Well, good evening, ladies and gentlemen. I have a fast-moving talk for you. I think you'll enjoy it, but you'll have to pay close attention. So here we go. Let me ask you, fine ladies and gentlemen, this question before we get started. Will an M-Sculpt Neo treat everything that's going on with these people? Do you think that you can beat bad nutrition and, as we would say in the United States, stuffing your face with food that you don't need? Think about it. So, here are the structural dynamics of this presentation. First, I like this quote from Chun-Tse. I hope I'm pronouncing that correctly. Do not embark upon a campaign unless the objective is clear and the time is right. And secondly, from the author of The Art of War, victory comes from finding opportunities in problems. And we're going to talk about both of those in my presentation tonight. Here are the clear objectives of the talk. We're going to talk about the incidence of mental disorders and aesthetics, the USA, Hong Kong, and Asia. The likelihood of finding opportunities in problems. What is the likelihood of your finding opportunities in the problems that you encounter in your practice? I'm going to review some groundbreaking studies on ExoMind. I'm going to tell you about our experience at Cady Wellness Institute, what we have seen and what we have been doing with ExoMind. And finally, I'm going to give you a possible explanation as to the dramatic and rapid improvement that can be seen with just a few ExoMind treatments, as opposed to the former TMS treatments that I used to use, which took 30 treatments, sometimes 36 treatments, where people would come in Monday through Friday for 5 weeks in a row, and sometimes week 6 and an extra day as well, which took lots of time, lots of money, and it didn't work nearly as well as the technology that we have today. So let's start with the opportunities that we can find in problems. First of all, 50% of individuals who are seeking aesthetic procedures fulfill the diagnostic criteria of a psychiatric diagnosis. Secondly, body dysmorphic disorder ranges from 5 to 15% in some studies and up to 50% in other studies in the aesthetic population. Initial satisfaction following aesthetic procedures is usually transitory and usually doesn't stay positive. So in my country, the United States, and I take this because the topic is the use of ExoMind in aesthetics in the United States, the prevalence of psychiatric disorders in elective plastic surgery patients in the U.S. is 72.4%. If I was going, pay attention to this, if I was going to divide the room and get 72.4% of the people, I'd start right here, I'd go all the way over here, and that would be 72.4% of the population. 72.4% of patients that have elective plastic surgery have a psychiatric disorder. And 44% of the aesthetic population that had a psychiatric disorder, the most common ones are depression and anxiety. Very quickly, oh, and by the way, you all will have access to this slide deck so you can look at the fine print at your leisure. And also, it will be translated into Chinese for the Chinese-speaking friends that we have with us tonight. So these are mental health treatments, barriers in different age groups in the U.S. I just want to call your attention to a few statistics. In adults, why don't they get treatment? What are the barriers? Well, 57% thought that they could handle their issues without treatment. 51% couldn't afford it. 38% didn't know where to get treatment services. And ladies and gentlemen, they are lying on your treatment tables, and they don't know where to get the help. Maybe you could be the answer to the problems. And teens, of course, teens think they're going to live forever and nothing will harm them. And 87% thought that they could handle the issue without treatment. So that takes care of the teenagers. Now, moving to this part of the world, Hong Kong and Asia, I did a little literature review, and this is what I found. In Hong Kong, there was a study called the Mental Morbidity Study. It was found that 13% of adults in Hong Kong met criteria for mental disorders. That's 13% of the population here in this magnificent city. And the most prevalent was mixed depression and anxiety. And another study found that frequent exposure to filtered images and beauty standards online also led to dissatisfaction with their appearance, anxiety, and depression. That's in Asia. So the noted author C.S. Lewis in England had this insight that mental pain is less dramatic than physical pain, but it is more common and it is more hard to bear. So let's remember that with our aesthetic patients. Now, in the U.S., we use what's called the DSM-5, our diagnostic guide for the diagnosis of mental disorders. In China, it's the CCMD-3. Interestingly, the criteria for depression is largely the same. And I'll tell you what the CCMD-3 has, that there are 9 symptoms of depression and 5 are required, same as the U.S. You must have 2 core symptoms: persistent low mood or sadness, loss of interest or pleasure, and in China, fatigue or decreased energy can be one of the cardinal symptoms. And then there are additional symptoms, and you can read them at your leisure: sleep disturbances, appetite problems, psychomotor retardation, weight issues, and even suicidal thinking. We've seen this slide already. I just want to emphasize it. Here's how it evolved. 1938, electroconvulsive therapy was the first neuromodulation technique that was invented. And then 85, TMS was invented by Barker, but it really didn't get going until later when the FDA cleared it in 2008 for the treatment of major depressive disorder, and then 2013, and then 2018, the FDA cleared it for OCD. Now, I'm going to show you a few slides from BTL, not many, and I'm going to conclude this presentation with a couple of case vignettes that I think will be impactful. The question is, does this device really work? We've heard from our first speaker that it is remarkably safe, but the question is, does it really work? So we'll get there. So this was the first study, first of 2 that I want to present. This is the so-called mental well-being study that BTL did. And here's how it went. There were 33 subjects, 7 males, 26 females, 25 to 78 years of age. I will point out that some of them were up to 43.1 kilograms per meter squared in terms of their BMI, which is quite overweight. 11 of them had diagnosis of depression, and 1 of them had major depression and anxiety. That was the population. So you will note, if I may point this out to you, there were 33 subjects, and 12 of them had a diagnosable psychiatric disorder. That means that 21 did not. 21% were not diagnosable with a psychiatric disorder where you'd say, you're depressed, you need to see the psychiatrist. You have a generalized anxiety disorder, you need to see the psychiatrist. But they weren't mentally well, and I'll show you how that was assessed. These people had 4 treatments with the ExoMind, 5 to 10 days apart. 4. Can you really make a difference with people with 4 treatments with the ExoMind? How many say yes? How many say no? Good. We got honesty down here. How many don't know? Some of you are ambivalent. All right, I'll show you what you can do with this machine. And the main relevant scale, this is a very useful scale, the Warwick-Edinburgh Mental Well-Being Scale. Warwick-Edinburgh Mental Well-Being Scale. And I'll show you what that scale looks like. Here it is. And here is the web link right here. Or you can just go home and type in Warwick, Warwick-Edinburgh Mental Well-Being Scale in Google. And here's what it looks like. So, this is not a psychiatric diagnostic scale. I want to call your attention to some of these, like I've been feeling optimistic about the future. That's not a psychiatric diagnostic question. I've been feeling useful. I've been feeling relaxed. I've been feeling interest in other people. I've had energy to spare. I've been dealing with problems well, and none of the time, rarely, some of the time, all the time. I've been feeling loved. I've been interested in new things. I've been feeling cheerful. These were the things for mental well-being. So here were the results after they had 4 treatments. About 84% of all subjects improved in their total score with 4 treatments. Those with low well-being initial score, of the low well-being initial scores, 50% of these people improved to moderate well-being. Subjects that had an initially moderate well-being, well, another half of those improved to high well-being on that 14-item score. So that was at the end of 4 treatments. What happened at 1 month? Here's what happened at 1 month. 90% of all subjects improved in their total score. So more people were improved 1 month later than after the 4th and final treatment. That's very interesting. The benefit improved over time. Those with low well-being initial score, this is what happened to them. About 2/3 improved to moderate well-being, and about 17% improved to high well-being, and these are people that started out with a low well-being score. I thought that this study was remarkably compelling. It does appear that the ExoMind with 4 treatments does improve mental well-being on this score. Now, there are other scores that can be used. This was the main score in this study. And subjects that had moderate well-being, 52.4% continued at a high well-being. Okay. So here are the results at 3 months. Now, 87.5% of all subjects have an improved total score. Those with moderate well-being, initial score, half of those improved to scores showing high mental well-being. What happened to the patients that were diagnosable with depression? After the last treatment, 83.3% improved in the Warwick-Edinburgh Mental Well-Being Scale. Then it was followed up at 1 month, and the results were even more impressive. At 1 month, 90% had improved, and the improvement was by 10 points on average. And if you remember, that's 14 questions and 4, so the maximum is 14 times 4, that's 56 that would be the maximum score, and these people are improving by 10. That's fairly impressive. And 80% reported feeling, their mental wellness and mood had improved. They were less depressed and anxious. They were being in a good mood after treatments. They were thinking more positively, and it was easier to fall asleep. That, ladies and gentlemen, is mental wellness. It's what we want in our patients, whether we're psychiatrists or predominantly focused on aesthetics. And this was an amazing finding. This was the so-called numeric analog scale of pain. So the question is always, does this treatment hurt? So 10 is the most, I'm not used to this clicker. 10 is the most excruciating pain you can imagine. 0 is none, and this is where they found 91% comfortable. 0.2, not even at a 1. So the treatment was very comfortable. How were the patients in terms of their satisfaction? 3/4 of them improved, more focused, having more mental energy after treatments. I was talking to someone today. He said that his wife had complained that it took him a while to boot up his brain in the morning. And he said it was like the difference between an SSD hard drive or a floppy disk. And now he was booting up more rapidly. I thought that was interesting. I've never asked my patients how long does it take to boot up your brain, but I probably will in the future. About 88% were in a good mood after their treatments. This is at the end of the study. 80.6% felt more calm after treatments, and no serious adverse events were reported. That's the mental well-being study. I thought that was very impressive. Again, 4 treatments. Could it really be that good? Could it? Can you do that in 4? Can you reasonably expect to do that in 4 treatments? Stay with me. All right, so the conclusion was I'll use the laser pointer here, 90% showed improved well-being, 90% reported the treatments were comfortable, and no serious adverse events were reported. Pretty impressive. All right, now this is the study that I got involved with, that I had to sign a non-disclosure agreement, and I could not even tell my wife what I was doing. I couldn't tell anybody what I was doing. Couldn't tell them I had the machine, couldn't tell them I was using the machine, couldn't tell them what I was looking at for the machine. We occasionally had a BTL person come through our clinic, and when they did, we'd throw a blue blanket over our device because we didn't want them to see it and ask, what is that? So this was a study, very interesting study. So the study hypothesis was that if we stimulate the left dorsolateral prefrontal cortex, right here, where the brain has self-control and executive functions, we could improve self-control in terms of eating and food craving. And we hypothesized, or actually BTL hypothesized, I was one of the researchers, that there was going to be a reduction in the food craving questionnaire which would serve as a measure of self-control. So could we measure what we were thinking we would find? And the answer was yes, we could, and yes, we did, and yes, it worked. The purpose of the study was to evaluate rapid TMS on improvement of self-control and subsequently food cravings. That's the purpose. The hopeful endpoints were increased behavioral regulation and adoption of a healthier diet. Now, I will tell you, as I did this study, there was a long informed consent that patients had to sign. It was like 8 pages. And one of the things that they had to sign was that they would not do anything different during the study. They would not get a gym membership. They would not start exercising. They would not change their diet. They would do nothing different. Do you think that worked? It didn't work. Because as I was treating these people, they would come in and tell me things like, well, you know, I'm feeling so good, I decided to start exercising. What am I going to do? Tell them, no, you can't exercise? Or, I've decided to take up intermittent fasting. Okay. I didn't tell them to do that. They couldn't help themselves. They were feeling better. They wanted to make some changes in their life. I'm not going to dissuade that. So this was the way the study went. It was a multi-center sham-controlled, which means I knew if they were getting placebo, but they didn't know if they were getting placebo. Single-blinded study, and we enrolled up to 60 subjects in the active and sham groups in the ratio of 3 active treatment to 1 sham. And we gave them 6 treatments spaced 3 to 7 days apart. The way it typically worked out is a couple of treatments a week for 3 weeks. That's the way it was done. The data collection was after the last treatment at 1 month and 3 months after it, and here are the scales that were used. The brief self-control scale, the food craving questionnaire. You can download either of those off of the internet. Just type in the questionnaire and you can download it in PDF. And we did the weight, waist, and hip measurements, and we did a satisfaction survey, and we had the patient complete the patient comfort satisfaction at the end. Okay, so this is what happened. 71.4% of the subjects improved on the brief self-control rating scale. 85.7% improved on the food craving questionnaire. I had spontaneously reported things to me as the study was going on, like, you know, my husband asked if we could go by Long John Silver's. It's a place in the U.S. that has fish that's fried. It's very fatty. It's very unhealthy. This patient said, that has been my undoing in the past. And I said, no, I think I want a salad. That was one of the spontaneous things that was reported to me. And just general, all around better control. Improvement on the brief self-control scale and things in terms of things like, I wish I had more self-discipline, I have trouble concentrating, I do certain things that are bad for me if they are fun. All of these improved. And I'll let you read over here on the food craving questionnaires. Food cravings invariably make me think of ways to get what I want to eat. I find myself preoccupied with food. Once I start eating, I have trouble stopping. Those are some of the questions that were on that questionnaire, and there was improvement across the board. Now, those are a couple of the BTL studies. Now I'm going to tell you a couple of my studies. So in my country, the Native Americans were there first, before the Europeans. And the Native Americans have great wisdom, and this is one of their proverbs. Tell me the facts and I'll learn. Tell me the truth and I'll believe. But tell me a story and it will live in my heart forever. So I want to close this presentation by telling you a couple of stories. This is Amy, image used with permission. Amy came into my practice on March 1, 2025, knowing that she was overweight, not liking the way she was, and thinking maybe a GLP-1 agonist was her salvation. I dissuaded her from that. 55-year-old, morbidly obese, depressed white female, her BMI was 42.9. Her chief complaint was, I just want to wake up and be happy. I have a great life, but my brain tells me you don't. Really deep down inside, I'm a sad, fragile person, and I hide a lot. I worry about things that are outside of my control. So it's sounding pretty depressed already. I'll show you her scores. She had an emotionally traumatic childhood. She's always battled with weight, and she was depressed. And she was on a few medications, desvenlafaxine for her depression. Now, by the way, this was not a study patient. If she had been a study patient, I couldn't have studied her because she was on an antidepressant and she'd been diagnosed with depression. This was my study. So, desvenlafaxine and citalopram, mixed salts of amphetamine for ADHD, and rosuvastatin. Here is her review of depressive symptoms. I've highlighted all three of the cardinal features in the Chinese diagnostic manual, and two of those would do just fine for American diagnostics. So when we count it up, 1, 2, 3, 4, 5, 6, she has 6 symptoms of depression, and all of the cardinal features, every one of them. And by the way, she also met full criteria for generalized anxiety disorder. Now, this is not a typical aesthetic patient. You might want to do Emsculpt Neo on her, but you might, if you got this history, you might want to refer her to a psychiatrist. But since I am one, I thought I'd treat her. So, I gave her everything. I gave her ExoMind and Emsculpt. So on March 15th, 2025, she got 2 ExoMind treatments sequentially, and an Emsculpt Neo treatment for her abdomen. And she came back on March 22nd, 2025, and her diagnosable anxiety and depression had been eliminated in 1 week. 1 week. Now, I haven't told you the mechanism behind that intensity of improvement and the rapidity of improvement, but I will, I promise. On exam, she had only 2 symptoms of anxiety, not enough to make the diagnosis, none for depression, and oh, by the way, she lost 1.5 kilograms in weight that week, with making no obvious changes in her diet. And so I gave her 2 more paired ExoMind treatments. Quick editorial comment, this is not a BTL-approved procedure. This is a CWI, Cady Wellness Institute approved procedure. I thought if this works this well for mental well-being, what if I gave people 2 treatments back to back? I'm not encouraging you to do that, but I'm telling you what I did and what the results are. And I also gave her Emsculpt Neo to the abdomen and Emsculpt Edge applicators to her waist. And I started liothyronine and metformin because she needed it. Okay, then she comes back in a couple more weeks. And I was about to give her the 3rd paired ExoMind treatment, and these are the words right out of the patient's mouth. She said, I cannot go to a negative place. That is something I'm not used to. I used to go home, be tired, put on a serial killer documentary that was dark and spend my afternoon watching those. But this week, I've been playing my music loud and enjoying it even more and cranking it up. Just going around the house cleaning and listening to music. Even at work, when I've got some downtime, I'll turn on music. I've never been here in this emotional state before. I've been in a place like this for a small amount of time, but never this long. She continued, it's kind of like a dreamlight steak. I never knew that I could feel this good again. I can't even go back to that dark spot. Even if somebody says something, I don't just sulk in it and stay with it. I've been sleeping better. Mental wellness. I haven't been napping. It's a harder sleep. I don't wake up as much, and especially because I don't feel like napping during the day. Wellness. I sleep more soundly, I guess. And her food cravings were solidly improving and maintaining. Then she came back 1 month after starting treatments and after just 6 total ExoMind treatments. She got them paired, 2, 2, 2. So this is after 3 treatments back to back. Her weight decreased from, well, it dropped 5 kilograms. Not on a diet, not on GLP-1s, 5 kilograms. Her BMI was dropping. She was still losing weight and concentrating on healthy eating, and she decided to start walking more and taking the dogs out for walks. She had no symptoms of depression or anxiety, and all standard rating scales for fatigue and sleepiness have gone to sub-threshold for both fatigue during the day and sleepiness. That's the first case. The second case is a little faster. This man is a 47-year-old interior and exterior painter. He had a good childhood, but hard discipline. Toxic relationships due to drugs, severe ADHD since childhood. He had a wandering mind, never can finish a task, and not on medication. His past substance use history was relevant for alcohol, methamphetamine, and opioids. He was currently sober and had been for some time. I started him on amphetamine salts because he needed it for his ADHD plus trazodone. I continued his Suboxone. And here are his rating scales. So after I started the mixed salts of amphetamine, his ADHD got clearly better, but here are his symptoms of anxiety with the cardinal feature of constant worry. Sorry. And here are his depression symptoms with 3 cardinal features and 2 more. So he was diagnosable with both anxiety and depression on May 10th. So you can imagine what I did. I gave him ExoMind, 2 treatments back to back. He came back 2 weeks later. All of his symptoms were gone. 2 treatments. 2 versus 30 or 36 treatments with the old technology. The only psychological and psychiatric symptoms he had were worry about finances. His partner says, we haven't argued but 2 times since he had those treatments. He's clearly sleeping better. I use these 2 normed scales, the fatigue severity scale and the Epworth sleepiness scale, which are common in sleep disorders medicine. They were normal. I gave him 2 more paired ExoMind treatments. Here he is a few days ago. This is after 2 sets of paired ExoMind treatments. 4 treatments total. Fully diagnosable with depression, anxiety, gone after 2 treatments. Okay, so the question is, I'm now rapidly coming to the end of my talk. Why does it work this well? BTL has told you it's a good technology. They have studies to say, well, it works with mental wellness. Well, it works for food craving. But how can it possibly work this well for serious depression and anxiety? And then secondarily, if it works this well in just 4 to 6 treatments, don't you think it will help your aesthetic patients who have a little bit of depression, a little bit of anxiety, and they are just not totally mentally well? Don't you think it might work for them? And I think it will. So, to review, the mental wellness study, 4 treatments. The food craving study, 6 treatments. That was all that was done. For these studies, I showed you that after 2 treatments, both of these people were better. I gave them a total of 6. So, here's why. And I used the old technology, which had a 0.5 Tesla magnetic field strength. And ExoMind has a 3.6 Tesla field strength at the core, which makes it 7.2 times more powerful than the old technology in magnetic field strength. But there's more. It delivers 6,500 pulses per treatment in the, it was, for my machine, it was protocol B. It was the food craving and also the mental well-being study. 6,500 pulses, which is 2.17 times as many pulses. So you do the math and you multiply them out, it's 15.6 times more potent per treatment than the old technology. 15 times more potent. 15 divides into 30 twice. So theoretically, you're getting the same amount of magnetic energy as 30 of the previous TMS treatments in 2. Now, there are some other things that are going on, including the time it takes for brain remodeling. Oh, and it's got double core technology, too, which even increases the magnetic field going into the brain more. So 15.6 times more just in terms of the potency and a more efficient magnetic coil. This is what the most prolific ExoMind user in the United States has to say about it. Jessica Barkley is her name. I think ExoMind is the neatest thing they've made yet. I think it has the capacity to be its own business. I also can see a room full of ExoMinds with multiple people getting treated. It's life-changing and everyone should do it. My conclusion. ExoMind in general aesthetics. It's my opinion, not BTL, it's not the FDA's. FDA has blessed it for major depression, not mental wellness. There are known mental health issues in aesthetic patients. I think I've established that. TMS was originally developed and FDA approved for the treatment of major depression with an exhausting schedule, 30 treatments with perhaps 6 more. There may be legitimate skepticism on how ExoMind can do any of these things that I've told you in 4 to 6 treatments, but you must remember, ladies and gentlemen, it delivers 15.6 times as much electromagnetic energy as one previous TMS treatment using the old technology. And so 2 treatments equals 30 of the old ones. And if you think about the magnetic energy delivered, you might want to give it 4 to 6 treatments to allow the brain neuroplasticity to develop, but the energy that is delivered is impressive. Here's my conclusions. ExoMind is breakthrough TMS technology. It is FDA approved for depression with the old protocol. It is exceptionally reasonable to use in general aesthetics practice for mental wellness and also for food cravings, and I invite you to try it. Now, I'm going to put this slide up here. And for those of you that have the fancy Asian phones that have the super zoom lenses, you can zoom in on that QR code, and this entire slide deck is at the internet waiting for you. Thank you very much for coming. It was a pleasure to present to you.